Hello, everyone. In collaboration with our supervisor, Dr. Katie Moisse, and fellow student colleagues, I'm very excited to present our research to you today. Due to the urgency of the pandemic, the FDA has granted the emergency use authorizations to a handful of treatments and vaccines that were sometimes solely based on the data they were provided with, as opposed to a traditionally peer-reviewed publication. Although we recognize that the FDA does have a review board, we sought out to explore the communication of these authorizations within the media. We gathered 99 news articles for assessment. We also performed an author credential analysis to assess any relationship between journalist education and various communication parameters. The 4 parameters assessed were the communication of uncertainties, the communication of limitations, the inclusion of advisory statements, and the referencing of reputable sources. Looking at our entire sample of articles, approximately 90% of the news articles did not convey the uncertainty associated with the treatment. Conversely, approximately 50% of the news articles conveyed the treatment limitations. Exactly 50% of the news articles used reputable sources, and as for advice, 40% advised readers to take a treatment or vaccine. More science-educated journalists conveyed the limitations of the treatments, advised readers to take treatments based on unpublished data, and employed reputable sources. However, we see that education aside, most journalists did not convey the unpublished nature of the treatment approval. The key takeaway from our research is that journalists failed to communicate the scientific uncertainties associated with COVID-19 treatments and vaccines. It's important to adhere to strict guidelines when communicating scientific information that has yet to undergo the traditional peer review process. Journalistic practices must be upheld to ensure that misinformation is not circulated between the media and its consumers. This research was limited by a small sample size and no statistical analysis. There's opportunity to address these limitations and assess the communication of other treatments or vaccines in future studies. We thank you for watching our presentation, and we hope to see you in our live session to discuss our research in greater detail and explore any questions you may have.